What role should HR really play in caregiver support? You may hear people say, HR gave us those benefits, but what happens next often reveals the real truth. Benefits alone don't move culture. They don't shift trust. They don't change behavior. HR sits in a unique spot. You don't just design the support, you help make it visible, usable, and sustainable. But if HR steps back after a launch, that support becomes symbolic. If HR steps forward with strategy, it becomes anchored in impact. So in this video, I want to sharpen the question. How should HR lead, not just administer, caregiver support? If we haven't met, I'm Dr. Anna Thomas. I'm a physician, leadership speaker, caregiver advocate, and corporate wellness specialist. I help organizations strengthen their workforce and create workplaces where people and performance can thrive together. Even as we enter an era of AI, automation, and agentic teams, the future of work is still human, and that work is changing dramatically. But at the same time, employees are navigating complex personal and professional pressures that are only going to escalate in the coming years. For example, in the next 5, 10, 15 years, we will see an exponential increase in the number of older adults who will need caregiving support. Who will be providing that care? Working adults. Right now, 63 million Americans are caregivers. That's 1 in 4 adults, with more than half of them currently working full-time. Those numbers are expected to increase and will have a tremendous impact on our communities and, yes, even our workplaces. And caregiving is just one example of a personal stressor that will impact the workplace. Mental health, chronic illness, stress, and burnout are all on the rise, and the organizations that will thrive are those that lead with care, culture, awareness, resources, and empowerment. Care. Through this series, I share practical strategies, leadership tools, and insights to help you create cultures that support well-being, strengthen engagement, and retain top talent. If you'd like a clear starting point, then check out my free training, The Future of Work is Care. The link is below. And while you're there, be sure to like, subscribe, and share this with another leader who is ready to build a workplace that cares. Let's get into today's topic. I've seen departments take on caregiving support like a project, a pilot, a benefits add-on, and then move on. But the organizations that get care right are those where HR plays a continuous strategic role. They're designing, they're tracking, they're coaching, they're iterating. Because caregiver support isn't a policy problem, it's a people and systems problem, and HR is the system owner. What HR often does. So HR often will default to writing the policy language, launching the program, communicating it during onboarding, and then waiting for the leaders to implement it. The problem is after that point, visibility drops, questions start to pile up, but usage stays low. A recent survey found that while a majority believed their companies understood and supported caregivers, few had formalized caregiving policies or had consistent training for their leaders. So HR in this situation becomes a facilitator, but not the driver of change. And the caregiving employees, they pay the cost because they don't know how to access the services. So let's shift the focus. HR should be the architect of that strategy. They should align caregiver support with talent, retention, engagement, and culture, not as separate programs, but as integrated levers. They're the policy and process builder. Policies must be clear, but most importantly, the process matters too. How people apply, how the leaders respond, how exceptions, if needed, are handled. They're also the enablement partner for the leaders. They need to co-train, coach, and support the leaders in how to lead their team, who may be caregiving as well, how to use discretion wisely, and how to monitor to make sure it's equitable. They're also the custodians of the data behind it, right? They have to collect usage, satisfaction, outcome metrics to make sure that we are going on the right path. HR leaders, you're also the advocates and translators for this. You're the bridge between caregivers and senior leadership. You translate those stories into strategy insight. You speak in terms of things like ROI and risk and opportunity. When you do these things, not just roll out a program, then you begin to see support stick. So if you're ready to move into that driver's seat and make the organizational changes to support the caregivers and individuals in your team who are balancing all of the other life stressors, then join me in my free training, The Future of Work is Care. It will help you apply the care framework to how your organization operates. And if you want it deeper, then check out my book, Workplaces That Care. It's built exactly for leaders like you. Think about this. When you're staying in the driver's seat, caregiver support stops being episodic. It becomes evolutionary. Your leaders feel equipped, your employees trust, you have the data to build the story. Leadership sees care not as a cost, but as a strategic advantage. And when you opt out of the launch, benefits, they'll sit unused. In the next video, we're going to talk about how do we support employees who are facing life pressures without creating resentment on the team. We're going to tackle how to frame support in ways that feel fair and inclusive. While you're waiting, check out how much of our leadership pipeline we're losing because of life and health pressures. It will help you see the stakes of HR stepping forward, or what happens if they step back. Remember, in this age of AI, the future of work is still human. So let's create workplaces that care together.